Hello, my name is Dr. Gary Radz. I am a general dentist in Denver, Colorado, and I would like to share with you um, some thoughts I have on the cementation of LuxaCrown restorations. I have been working with LuxaCrown for over a year. As one of the dentists in the United States that did some of the initial clinical testing on the material. So I've got an experience of probably getting close to 100 restorations in place right now. And one of the questions that I frequently receive from new users is when and where do you use different types of cements? So I've put together a quick summary. If you fabricated a crown and you're thinking it's going to be in place for 2 weeks to 2 months, then I typically will go back to conventional temporary cements. So your TempaSems, yeah, the TempSem ID, any number of different temporary cements that are on the market will work well for this purpose. If your thought process on a particular patient is you're looking at a restoration that you want in for 2 months to a year, and or if that patient presents with a significant caries risk, those crowns I'll put in with a glass ionomer cement or a resin modified glass ionomer cement. It'll help the long-term retention better, but also the benefit of some fluoride release can help if there's any marginal leakage. And again, if you are worried about the patients being a high caries risk patient. If the crown I fabricated, my intent is to have that in for 1 to 5 years. Now I'm looking at resin cements. So either a dual cure resin cement or a self-adhesive style resin cement. Either of these would be ideal in this particular situation. It'll give you the highest bond strengths and it'll give you the best seal at the margin. So depending on the individual circumstances around that particular patient and that particular restoration, I would think about these 3 different categories of cements and which one will best serve the purposes that you're intending the crown for. Thank you very much. For questions, I can be reached at gradz@smilesource.com. Thank you.